According to the Department of Health and Human Services, the national rate of people without health insurance dropped to a record low of 8% in the early months of 2022. But subsidies that are part of the Affordable Care Act are set to expire at the end of the year, and if Congress fails to extend them, roughly 3.1 million people would become uninsured. For more on this, we're joined live on the KCBS Ring Central Newsline by Paul Seegert, managing partner at California-based healthcare benefits firm PCS Advisors. And Paul, thanks as always for joining us to discuss these things.
Happy to be here.
So let's start with the good news. The rate of people who are uninsured is at a record low. Did you expect this to happen?
Yeah, we did. What happened was, as part of the COVID rescue legislation or COVID relief that we experienced, we took away the income limit. So anybody that went to an exchange around the country, nobody that went to an exchange would spend more than 8.5% of their income. So then you had people at the top tier of income that wouldn't have been able to qualify for a subsidy in the past, started to be able to qualify. And then you had people that on the bottom end of the ladder, those in poverty. I think through better education, we added quite a few there as well.
The subsidy we're talking about here, one of the major problems with opponents of the ACA is they've been trying to get rid of the act, but they don't have a replacement. And is that true in regards to the subsidy?
Well, that is true. Yeah, these were temporary subsidies. The thought was that a lot of people would be losing coverage because they were losing their employer-based coverage. And so we spent quite a bit of money as a country to expand these subsidies. There's an argument to be made on both sides. The subsidies, the change that they influenced was such that you could have a couple today that's 60 years old making north of $200,000 a year, and they could get some subsidy were they to go to the exchange. So we actually saw a shift of people who left other coverage because it became more favorable to them to access it through the exchange where they could get a subsidy, maybe even more favorable than continuing to get it at their place of work. So while we did achieve something certainly by getting the lowest unemployment or the lowest uninsured rate, we did also move quite a few people, millions of people off of other coverage, which likely they would migrate back to if these subsidies were to end.
So for people who are likely to be affected if the subsidies do end and don't have that substantial income that you're talking about, what should they do to get ready?
Well, the folks that are on the lower end of the income scale will continue to qualify. They qualified before these extra subsidies. They'll continue to qualify after. So it's a little bit ironic that we picked up more. The folks that stand to lose the subsidies tend to be at the higher end of the income where you can qualify for subsidies today. So hopefully what we'll see, we need some good messaging out there if this stuff does come to an end, and we need to continue to educate people on what is available to them, what they actually qualify for. It's a big win for the overall uninsured rate in our country through COVID was just the fact that we extended the enrollment period and did a lot of messaging around the fact that you can enroll, you can get coverage. And whenever we do that, we add to the number of people who are covered who may have already qualified but weren't fully aware that they did qualify or for one reason or another hadn't enrolled.
Okay, Paul, we have to leave it right there. Thanks again for joining us. Have a good weekend.
Thank you. Have a good day.
That's Paul Seegert, managing partner at California-based healthcare benefits firm PCS Advisors.